Second white coat. Subscribe and like. Let's learn medicine together.
All right, let's dive into a real medical mystery. You've got a patient who has all the classic signs of a major stroke, but when the doctors look at their brain scan, there's nothing. It comes back completely clean. It's a case where the clues just don't seem to add up at first, so let's piece this thing together. And that gets us to the central question, right? How is it even possible for someone to have a stroke that's basically invisible on that first critical scan? It's a total paradox, one that puzzles even experienced doctors. But the answer reveals something absolutely fascinating about the deepest, most hidden parts of the brain. So how can it happen? Our story kicks off where so many of these medical dramas do, in the emergency department, with a patient who knows, deep down, that something is terribly wrong. So, picture this. A 58-year-old man is just going about his day, doing his thing, when suddenly, bam, one entire side of his body just gives out. He's rushed to the hospital, and the medical team is immediately thinking one thing: stroke. But here's where things get really specific. He has this significant weakness on his right side, but that is it. He can still feel everything perfectly, his speech is totally clear, he's not dizzy, no problems with balance, so this isn't a global, system-wide failure, it's incredibly focused. Doctors have a name for this, a pure motor deficit, and that very specific clue is going to be crucial to cracking this case. Now, with a suspected stroke, you know the clock is ticking. Every second matters. So the first, most important step for the medical team is to get a look inside that patient's brain. And this is where the mystery just gets deeper. Because on the one hand, the physical exam is undeniable. The man has severe weakness, no question. But on the other hand, that initial CT scan of his brain comes back completely normal. There's no sign of a bleed, no obvious damage. The evidence just doesn't add up. So this raises the million-dollar question. How can a brain that looks perfectly fine on a scan be causing such a profound, one-sided paralysis? You even start to wonder, is this really a stroke at all? The investigation has to go deeper. You know, the answer here doesn't come from some new high-tech test. It actually comes from the passage of time. Because eventually, the brain reveals its secrets. The full story really unfolds over a few weeks. So on day 1, you've got the clear symptoms and that confusing normal scan. But fast forward 4 weeks, they do a follow-up scan, and this time, there it is. A tiny 9mm fluid-filled cavity deep inside the brain. The damage was there all along, it just took a while for it to become visible. And this finally brings us to our diagnosis, a lacunar infarct. The name lacuna actually comes from a Latin word that means lake or pit, which is a perfect way to describe what's left behind. This is a tiny stroke caused by a blockage in one of the brain's smallest, deep-diving arteries. Then, over a few weeks, the body's own cleanup crew comes in, removes the damaged tissue, and leaves behind this little fluid-filled lake. Okay, so we know what happened. Now we have to answer the most important question of all. Why did it happen? Who or what was the culprit behind this invisible stroke? The answer, it turns out, is something shockingly common: chronic high blood pressure. In this patient's case, he actually knew he had hypertension, but wasn't taking medication for it. And that's the real danger, isn't it? It's a silent condition. Over years and years, it wages this quiet war on the body's smallest blood vessels, and you never feel a thing. So here's how it plays out over time. All those years of high pressure just pound away at the delicate walls of the brain's tiniest arteries. Those walls start to thicken and weaken. It's a process called lipohyalinosis. As the opening of that artery gets smaller and smaller, it becomes a perfect trap for a tiny clot to get stuck and block it completely. Blood flow gets cut off, a tiny piece of brain tissue dies, and a few weeks later, all that's left to see is that little cavity, the lacune. But wait, how can something so small cause so much damage? Well, in the brain, it's all about location, location, location. This little stroke happened in a spot called the internal capsule. You can think of it as the brain's motor superhighway, where all the nerve fibers controlling your movement are bundled together in this tight, dense cable. A tiny lesion right there is like a rock slide on a major highway. It can completely shut down traffic to one entire side of the body, causing that pure motor weakness without messing with anything else. Now, to be 100% sure of the diagnosis, good doctors have to act like detectives. They have to rule out all the other possible suspects for the patient's symptoms. And you can see pretty quickly why other conditions were ruled out. A stroke from a blood clot from the heart? that usually causes other problems, like trouble with speech. An aneurysm rupture, that gives you the worst headache of your life, and you definitely see blood on that first CT scan. None of these other things fit our patient's very unique, pure motor symptoms. All the evidence pointed to just one suspect. So, what are the big lessons from this whole case? After everything, what should we remember about the invisible stroke? Here are the key takeaways. These small, deep strokes are almost always caused by chronic high blood pressure. They create these classic, clean, pure syndromes, affecting just motor function or just sensation. And, most importantly for our mystery, the initial damage is often so small that the first CT scan can come back looking totally normal. And let's just come back to this number, 9 millimeters. That's less than a centimeter. We're talking about a lesion smaller than a pea that was responsible for paralyzing half of this man's body, all because it hit the exact right, or in this case, the exact wrong spot in the brain's incredibly complex wiring. And this really brings us to the final thought here. This whole life-altering event was caused by a condition that often has zero symptoms until it's too late. It really makes you wonder, doesn't it? What other silent problems could be hiding in plain sight, and what simple checks could we all be doing to prevent a catastrophe down the road?